One. Tim Bennett here from the Cortland Voice, and I'm here with Dr. Seemant from Cayuga Health. Good morning, doctor.
Good morning. Thank you so much for having me, Tim, today.
For sure.
It's my pleasure.
Beautiful. Today we are going to speak on osteoarthritis, but before we, educate the community on that, let's hear some things about you, doctor.
Thank you so much. My name is Dr. Seemant, and I am sports medicine physician at Cayuga Medical Center currently. I've been here in Ithaca for about 8 years now, and time flies. It's been so long already. I started the osteoarthritis clinic because I think there is a lot of people who are misinformed about osteoarthritis, or they do not have enough information to how to take care of it. And that's the purpose of it, to get patients who will benefit from the conservative care rather than knowing about arthritis and knowing that the only treatment is joint replacement.
Okay, so many know about arthritis, but what is osteoarthritis and is it common? Tell me about that.
That's a great question. There are a variety of arthritis that affects the joints. Arthritis is basically any injury or inflammation of the joint. There is rheumatoid arthritis, which is different from osteoarthritis, which we'll be talking about today. Osteoarthritis used to be thought of as just the mechanical wear and tear of the joint. As we age, we do damage to the joint, and that's what we used to call our osteoarthritis. Nowadays, we understand that it's just not classic mechanical wear and tear. Now, our joints have the end bones lined with a smooth lining called cartilage that provides a smooth gliding surface. Over the years, because of any injury or trauma or overuse, because of the mechanical loading, there starts an inflammatory process that affects every part of the joint. It degrades the cartilage. It affects the lining of the joint. It increases the fluid inside the joint because of inflammation. That does not provide much lubricant action as it's supposed to do. And also it causes new bone formation that causes derangement in the joint. So overall, we look at that the whole joint is affected rather than one single piece of structure of the joint. Okay. That's what osteoarthritis is.
Got you. So let me ask you this, and I'll flip it and rephrase it.
Sure.
What causes it? And who's at risk?
So everybody is at risk of osteoarthritis because this is very much age related. Age is the biggest risk factor. You will not see osteoarthritis in kids. Most of the osteoarthritis develops as we age. And any sort of injury to the joint or insult to the joint, which could be fall on the joint, like you fall on your knee, that starts some inflammation. The other risk factors can include any biomechanical derangements. For example, somebody has a flat feet or something, or the knee is knock knee or a bow knee that affects the loading of the joint, can really be a risk factor. Another risk factor is weight, because 1 pound of body weight is 4 pounds on your knee. So anybody who's in the overweight range poses a big risk factor. And this is the biggest modifiable risk factor that we work with.
Understood.
But again, like I said, any injury to the joint or, which could be recreation, which could be sports related, which could be occupational, any sort of thing.
Okay. So if someone has it and they don't treat it, so if it goes untreated, what happens if it's untreated? I should just say it like that.
Yeah, sure. Sure. So once we find out that somebody has osteoarthritis, we all know that there is no preventative medication like we have for rheumatoid arthritis. We do not have any medication that you can take that, okay, now we know that there is osteoarthritis, you take the medication and it will stop. No, the problem with osteoarthritis is that it's a progressive disease and it will continue to progress with time. There are only few arrows in our quiver to fight it, which includes physical therapy, strengthening exercises, staying active, and not gaining weight. Apart from that, there is no other modalities or treatment that will slow it down. It will eventually progress, but this is our best foot forward.
So, um, is this something that you would feel like is genetic with family or
That is correct.
that? Oh, so it is.
It
Okay.
is. It is. There's a 65% heritable component, so it runs in families.
Mm,
And there are many genes that have been looked into that are precursor or related to development of osteoarthritis. But that's more research based at this point.
gotcha. I wasn't sure if it was nature versus nurture, just because the fact of if it's something with nutrition, if you said overweight, if I choose to eat, I don't know, 1,000 pies, and my dad didn't eat pie and he's healthy, I'd be doing it myself because I love, the
That is correct.
boom. So nutrition plays a good role too then.
Nutrition does help, you know,
Well,
being
I'm
careful
I'm
about it.
I'm glad at Cayuga Health, you guys have a great nutrition department that can assist with that too. And me and my pie, and I love pies and cakes. So my next question to you is, when should someone speak with their doctor about any concerns with their joints? Because I'll just give an example. I'm an athlete, which Cortland alum. So just shout
Yes.
out to Cortland. Because you said sports medicine and I knew Cortland
Uh,
has good athletics. Not saying
yeah.
everyone should go there, but it's a great school. Just
Yeah. I'm
saying.
the team physician for Tony Cortland. So,
See, and honestly, that was not I didn't know that. So that's a beautiful thing. See, great minds think alike.
yeah, yeah,
Wow,
yeah.
that's beautiful. But what I was going to ask you though, is so as someone gets older, so me myself, I feel young. I,
Yeah.
30, I'm 37 years old. And the thing is, as an athlete, I start feeling different things. Like, what's the difference between if someone goes for a walk or if they're athletically feeling different aches, or
Mm-hmm.
is there a certain different feeling that they should know? Like, okay, it went away in a week, so it might not be this, or how can they tell if it's just a nagging thing or if it's
Mm-hmm.
age and
Yeah.
possibly that? Like, how can they
Sure.
tell?
Okay. So that's a very good question. How to differentiate osteoarthritis from other aches and pains? So somebody who's starting exercising or somebody starting to walk might have like delayed onset muscle soreness, which we should not implicate towards osteoarthritis. But when somebody has osteoarthritis, symptoms can wax and wane.
Mm,
They would have pain. They would notice stiffness after inactivity. For example, if you're sitting in a car for a 2 hour car ride, you come out of the car, you're like, oh, the joint feels stiff. It's not moving as it should. And it takes some time, like less than 30 minutes to get it moving. So that is inactivity related stiffness, which is very much kind of points towards osteoarthritis. The other is like the pain. Pain can be constant, you know. Symptoms overall, if you look at the bigger picture, wax and wane.
mm-hmm,
Sometimes osteoarthritis symptoms can occur immediately, like it just comes on very quick rather than a slow progression.
mm-hmm.
Uh, and sometimes it's a very slow process where you would feel aches and pains which get worse over time. So, in one line, I would say anybody who has pain which is constant, not getting better, unrelated to activity, has a stiffness, those are the main pointers towards
Okay.
osteoarthritis. And sometimes the joints swell. You would not see the joint swelling in the hip, but knee becomes obvious that people will know that there is swelling in the knee most of the times.
Gotcha.
Yeah.
So my next question is, can it be healed? And what kind of treatments do you offer at Cayuga Health?
So, like I said before, there's not much medications out there at this
Mhm.
time for osteoarthritis. So we have to work with whatever we have. So, like, our goal is to provide conservative care until somebody needs surgery and to get the best quality of life. So, main treatments include education and information is the most important thing in my understanding, because if person knows what's going on, they are better empowered to take care of it. So, when I see my patients, I try to educate them on what's going on, what are the risk factors,
Mm,
what you should do not to push the gas, so
mhm.
to progress it faster. So most important thing is getting them into with physical therapy, because whenever there's a joint pain, the muscle inhibits and does become weak over time. So when there is weakness, you need to strengthen the muscle. So it provides support to the joint that it's working with. Uh, Physical therapy also works on range of motion because that gets limited in osteoarthritis for the most
Mm,
joints, though it can happen later in the phase, but you can tell. So working on range of motion, working on strengthening. Physical therapy also helps um, evaluating for any need for insoles, any biomechanical disorders, or any corrections that are needed for orthotics or taping of the joints and things of that nature. We have a very good physical therapy department here at Cayuga Medical Center. And one of the physical therapists, Hilary Jones, really is interested in taking care of osteoarthritis patients. So she's a part of the osteoarthritis clinic.
yeah, I think that's awesome, and
And
I
now,
feel like,
and again, we also work with losing weight. If somebody is in an overweight range, we want them to lose the weight because that is the biggest modifiable risk factor that protects your joints. It's not only the knee, hip, and also it provides cardiovascular benefits from losing weight. So if somebody, I try to guide them on that diet plus exercise is better than either alone. But
mhm.
if somebody is not able to achieve that goal, we work with a Cayuga Center for Healthy Living, which is on the fourth floor at Island Health and Fitness, or third floor on Island Health and Fitness. And they work with the nutritionists, and Dr. Sandage is the director there, and they guide patients on how to lose weight, and it works very well. It goes from behavioral to medication, and if somebody needs surgery, like bariatric surgery. So that's we collaborate with them for helping patients lose weight.
Awesome. Let me ask you this. How can someone support a family member or a friend who has osteoarthritis? And if someone, so it's going to be a two-part, and if someone may be concerned, what can they do to prevent or slow down, the symptoms of that?
Yeah, the same thing I talked about. These are all conservative treatments. But again, if all of this is failing, and then my role comes in after educating them and all trying all these things, but someone's still in pain, then what we do is we do ultrasound guided corticosteroid injections for pain relief,
Mhm.
which can be done every 3 to 4 months, and that does really work very, very well. If the cortisone injections fail, there is joint lubricant shots that can be done, which we use the ultrasound too. So that makes it very accurate. Uh, and we are also kind of evaluating them on a regular basis to see how they're doing functionally, and that kind of thing. So if somebody is still struggling as a family member, I would work on talking into trying to control pain. So in one line, I would say we look at overall quality of life,
Mhm.
which includes conservative care and improving their quality of life with functionality, and also corticosteroid injection if needed, or
Okay,
something like for pain control that we talked about.
awesome. Doctor, is there any other words or comments or a message that you would like to leave with the Cortland community?
Yeah, absolutely. I think we all know that osteoarthritis is very common. It involves about 10 to 12% of population here. But when it becomes symptomatic, I would say that we should try to get back into seeking care for it rather than ignoring it. And there's a lot that can be done, and we should always pursue the treatment that we have here at the Osteoarthritis Clinic. And I'm happy to answer any questions, if somebody has questions and things like that.
Beautiful.
But
Well,
again, we can keep fighting the fight.
for sure. Keep fighting the fight. I like that. Be
Yeah,
resilient. Keep fighting the fight. Well,
yeah.
Dr. Samant, thank you very much for joining us again. And to those watching, thank you for choosing the Cortland Voice. God bless.
Thank you so much, Timothy. Really appreciate it.
You're welcome.
You have a good day. Thanks.
You too.